I would like to welcome our next speaker, Dr. Oksana Sawiak, to the podium. Dr. Sawiak is a retired dentist from Mississauga, I can't say it, Mississauga, Ontario. Graduated from the University of Toronto. She's a master of the Academy of General Dentistry, the first woman and the third dentist in Canada to achieve this. She's an accredited member of the IAOMT and chair of the Biological Periodontal Therapy Committee. Please welcome Dr. Oksana Sawiak.
Thank you very much. If I could get everybody to move up a little bit because you're all scattered so much, I'd appreciate it. Who here loves to do perio? Very few. How many here often hear a groan from your patients when you say, oh, you need gum treatment? Thank you. Thank you for choosing this breakout, by the way. You will learn that people want to have healthy gums, to have sweet breath. But when they don't see the connection between cause and results, but just hear, well, you have to come back in 2 months, they get discouraged. And your recommendations then fall on deaf ears. Is it okay if I tell you a little bit about myself? I graduated from dentistry learning how to scale teeth and was never very good at it. I never could figure out which scaler went on which tooth, in which angle, and how to sharpen it. Because I didn't like it, I guess I didn't really look for it. But when it hit me in the head, I did scale them, and I said, you've got to brush, you've got to floss, you have to do this, you have to do that. And next time they'd come back with the same problem. So I would admonish them again, and it would be the same thing. So I got discouraged by the non-compliance of my patients, and I would send more and more to the periodontist. After instituting a meaningful perio program using microscopy and some natural agents, I found that my perio brought in 25% of my gross income. And that encouraged me. I became passionate about it again. My own story is that I had perio disease in dental school. I had a pocket that the periodontal department needed to surgerize. They did. The pocket came back. And eventually, a few years later, I had a whole quadrant of perio surgery done. After having that done, I said I would never go through that again. I would rather lose all my teeth than do the rest of my mouth. So I think that I translated that to what my patients would like, and that's where part of my philosophy changed. I do have a disclaimer to make. I do not have any financial interest or a product in my talk or with any company companies offering grant monies for this continuing dental and medical education program. Notice that we do a diagnosis by saying, okay, how deep are the pockets? Is there bleeding, swelling? Is there halitosis maybe? Recession, calculus, how heavy is the calculus? How much plaque do they have? And maybe do lab tests like DNA, BANA, etc. How many of these address the cause of the problem? How many even identify the cause of the problem? Any suggestions? They really don't show a cause. They are a diagnosis. They are a picture, a clinical picture, but they are really not a diagnosis. They are really not identifying a cause. So if they continue doing what they've been doing, what can they expect? With the IAOMT protocol, you can offer them a different future. You can actually offer them a cure. You can say, where will this person be in 1 year, in 5 years, in 20 years? What can you offer that is different? And what can you promise them? You can offer them a cure rather than maintenance. Not just management of a chronic disease. Not what most dental offices do, and that's supervised neglect. You can promise to a patient who opts for your direction that they can expect to have their teeth for a lifetime, that they will die with all their teeth intact unless other problems cause them to lose them, and that they will be healthier than the average person since their oral health will be intact. The oral infection is a cause of heart disease, of other chronic problems, as we all know and as we heard before. The accepted protocols that most dental offices, outside of course of IAOMT offices, have is scale as soon as the new patient enters, clean the patient up before the dentist sees them, bring them in as often as the insurance will allow you to clean them up, to maintain them plaque-free, to keep them from breaking down. Do quadrant scaling, which we've heard from Dr. Kennedy that it's like wiping half of yourself. Antibiotics, which is something that medicine uses indiscriminately still by saying, well, you have an infection, let's try this antibiotic. If it doesn't work, they change to another antibiotic without knowing what they are treating, without identifying it. Laser surgery, other surgery, grafting. I consulted in an office where 20% of the income was from grafting procedures. And that's sad. And of course, the referrals that we get are going to be based on this. We know from Dr. Kennedy's lecture that perio is an infection. And if you've heard my presentations, you will have heard me admonish you to treat the oral infection as a whole body infection, and not to scale, and not to probe, and not to touch till the infection is gone. When there is no infection, scaling becomes much easier. Lasers and root planing and surgery are rarely, if ever, needed. Who here has had gum surgery? Nobody. That's amazing. Well, that's great. As I said, my experience of it was that I wouldn't have it again, and most people that have been sent for dental, for what you call dental circumcision, come back, if they do come back, poorer, much more sensitive, and less willing to do the restorative that you have planned for them. So if you can keep the perio in your office, it is a much better idea. You have control over how far you can go, what is done, and how well it is done. Would you buy a service if you did not have an expectation of a positive result? For instance, if you had a wart on your thumb and you went to the dermatologist, and the dermatologist said, well, we can treat it by you coming in every 2 months, but I'm not sure that I can get rid of it. Would you buy that service? Or would you rather go to somebody that would say, I can get rid of it for you, for good? That is what we're doing with our patients. When we're looking for acceptance of our treatment, they need to feel and know that there is something at the end of the rainbow, that there is something that their money will buy except for supervised neglect or for the status quo that they are going through right now. So how do you get a patient to understand what their problem is when you're talking about perio? It's such a nebulous thing for many people. Well, if there's no understanding, there's no ownership. And if there's no ownership, there's not going to be any commitment. And it will be very difficult for you to get acceptance for your perio program. Some people will say, well, it's my heredity. My parents had it, my mother had it, my brother has it. Well, I can explain to them that heredity has nothing to do with it, but kissing your wife does. So to me, a picture is worth 1,000 words, and I use a microscope. Never has a picture of their oral flora under a microscope failed to evoke interest from my patients. Is that my mouth? Ew, that's moving. What is it? I don't want it. Get rid of it. This is where they start ownership, where they see a connection between what I see under a microscope and what their disease state is. So a picture is worth 1,000 words. How many here have a microscope? Wonderful. It should be 100%, because I'll tell you that as soon as they see what you see under a microscope, they are committed to doing something about it. It's the rare person that turns around and says, I don't care. The questions are, can I give this to my wife? Or could I get this from my girlfriend? Or could my dog have given this to me? These are questions that start that commitment to their health, to doing something about it. So the next question is, should I get my husband to come in? That's music to my ears, or was when I was doing dentistry. Most of the programs in perio are open-ended. They tend to be maintenance. They don't have a definite beginning and a definite end. They tend to be every 2-3 months or every 6 months, depending on how many pockets the person has, what the plaque level was, or what the insurance will pay. They're usually office-based. So if the person has a lifestyle that means that they're traveling a great deal and have to cancel a lot of appointments with your office, they don't get the care that they need. They don't get the help that they need. It's not very empowering for the patient, because they have to rely on your office to get well. They don't know what to do except floss, brush, maybe irrigate, maybe whatever, to help themselves get better and stay better. And quite often, the information is not really congruent. Your assistant will tell them, well, here's some Colgate and a toothbrush. And the hygienist will tell you, well, irrigate with Peridex. And the dentist will say, well, you have gum infection, but none of those things get into one meaningful sentence with one meaningful program. If we compare this to a chiropractor, I go to a chiropractor who diagnoses my problem and says, you are off by 12 degrees. Your head is off your atlas by 12 degrees. That's very serious. It's going to take 3 months to correct. It will cost you $680. To me, that makes sense. It does not make sense to me to go to a chiropractor and say, well, your neck is out. I'll need to see you 3 times a week for the next 6 months. Can you see the difference? There is a finite treatment plan, a finite financial arrangement, and a finite cause and effect. With perio, we tend to be open-ended, and that is very difficult for patients to accept and to go with. So then we, of course, look at, for instance, the supplies we carry in the office. How many here still use Listerine, for instance? Thank you. I'm glad not. But Colgate, fluoride, antibiotics, things that as biologic dental offices is not congruent with our statement, with our mission, with what we're all about. So, as we heard Dr. Remy say, if the terrain is receptive, we will get all these infections. But we need to look at nutrition as well. They're not going to accept nutrition at their first appointment. They're going to say, what's wrong with me? Show me. And then you might be able to pull them through to the fact that they need a lifestyle change. So in order to have acceptance of your perio program, the more you can show them, like the chiropractor who measured and showed me a picture, if you can show them a picture under a microscope and say, this is a serious infection, it is ruining your gums, it does cause you bad breath, it does cause you bleeding, swelling in pockets, that is understandable. And this program, or this seriousness of your program, of your situation, may take up to 7 appointments to correct. And that will take X number of weeks, and it will cost X number of dollars. And my hygienist here will supervise your program. She will lead you through the entire process. Is that what you would like? The acceptance of that is much easier than somebody saying, well, you have a gum problem and we'll work on it every 2 months. So even though nutrition, detoxification, lifestyle changes are part of any program in our dental offices, that initial time with the patient of identifying the problem, showing them the problem, getting their commitment to do something about it, and then showing them the protocols is much easier for the patient to accept. Compliance. Most of us say, most of us will say, well, the patient doesn't brush, so what am I supposed to do? The things that many patients will say to me as a wellness counselor now is, I have gone to my dentist and he or his hygienist complains that I don't brush, I don't floss properly, or I don't do this, irrigate. And we'll put a bit of plaque under the microscope and they are crawling with amoeba. When they're crawling with amoeba, they're not going to get any better. Their gums are not going to get better, and their health isn't going to get better unless they have a lot of intervention. So blaming them for their oral hygiene is the last thing that they want to hear, and of course, if they hear that often enough, they're going to leave your office for somebody else. So going back to things like the supplies you have in your office. Colgate and Crest, if you carry them in your office at all, what message are you sending? That you're no different than any other dental office. And here we're talking about acceptance and compliance, and the fact that a patient comes to you looking for something a little more complete, a little more different, because you are a biologic dentist. The protocols that we suggest, going back to Colgate and Crest, when you have special supplies that really work, you become the expert in your client's eyes. I know that using the natural products that are advertised by our exhibitors here, and the fact that they are not available in retail stores, is a great boost to the patient's feeling of specialness. Oh, I get the special stuff that Dr. Sawiak carries. It might not be important to you. It is important to the client and patient. The protocols we suggest, seeing you in 3 months and treating everybody with the same schedule and the same protocols, they feel like they are on a conveyor belt. They do not feel special. If a patient does not feel like they are your special project for that day, they're going to lose the loyalty that you want them to maintain. Do they understand why they need to come back every 3 months? How many here have cancellation problems or no-shows in their hygiene department? All of us do. And it is because the patient has not seen the value of that appointment. They really do not believe that what we're doing for them is helpful to their issue. And then if you say to the patient, oh, you're getting better, but then come back in 3 months. Is the message congruent? If I'm getting better, how come I have to come back in 3 months? So these are the things that we have to be very careful of when we are presenting treatment, when we are presenting follow-up. And have you ever gotten compliance by telling the patient off? Have you ever gotten a patient to do better by saying, you're not brushing properly? And no matter how kindly you say that, if you still say you're not doing it properly, the patient hears, what do I care? If all my efforts are worthless, why should I care? So what are the better paths to patient compliance? Again, we come back to a picture's worth 1,000 words. And when you have a microscope, it's so easy for anybody in your office to take, well, perhaps not everybody can go in the mouth and take some plaque, but certainly the hygienist, the doctor, or an intraoral assistant can go in there, take the plaque off a tooth, put it on a slide, and then anybody in the office should be able to read it, including your front desk staff. Because you're supposed to have a team. Not front and back, not clinical and office. You're supposed to have a cohesive team, and that cohesive team all should know what this is all about, and all should be able to do it. The reaction of a patient when you show them an amoeba is, ugh. But show them a trichomonad that's going around like a mouse and feeding, and they say, I don't want that, get it out of my mouth. The reaction is instantaneous and very predictable. You're not going to get that when you present them with a lab test. What does that mean, doctor? Well, it means you have an infection. Well, what does that mean, doctor? Yes, lab tests might be very helpful for our scientific minds, but for the patient they mean nothing. When they see a picture of a little mouse going on under the microscope, that is worthwhile for them because they can relate to a live something going and eating them up. So if they find it fascinating, or if they find it icky, or if they find it scary, whatever they find, you will have their commitment to do something about that. So enrollment happens when they own their problem. On their slide is their problem. They own it already. You can measure their pockets and their plaque index and their DNA and their BANA test, but nothing is closer to ownership than their plaque on a slide. When you have a microscope in the office also, you are perceived as being more scientific. You are perceived as being more thorough. You are perceived to be much more progressive and, of course, more caring than the guy down the street. So, she has a microscope is a marketing statement for your office. Think of it that way. She has a microscope. Wow, my dentist doesn't. Maybe I should go to her. When you say your slide shows, you have their interest, and they are much more interested in listening to your suggestions on what to do about it. And the great value of having a microscope is you have immediate information. When will I find out? As soon as we put this under the microscope, you will know. Really? It is a powerful, powerful modality. So are you in the 21st century? A microscope does not have to be a huge investment. They can be found on eBay. You don't have to have a very fancy one. I have just equipped a couple of offices under $4,000 per microscope, and that included the camera and the software for the monitor. You need a phase contrast microscope for best results, and you can talk to me about the various microscopes that I've had in my life. Dr. Remy is right, for those who heard him. The train is critical. And hopefully you can lead your patients to the point where lifestyle changes, nutrition, exercise, pH, all these things become relevant to them and become important to them. But you have to start somewhere. And starting with this is very helpful. And then you can take them gently to where you need to make their health and their perio a better idea, in a better space. And every person is unique. I'm sorry for the misspelling of Taylor, but nobody wants to be a case. And nobody wants to be just a protocol or have to follow the same protocol as their spouse or whoever. Because eventually you will find that if somebody gets results with your protocol, that is the standard one in your office, and somebody else does not, and they compare notes, they'll say, well, it worked for me, how come it didn't work for you? So they realize then that you're not treating patients as you people, but you have a protocol, a factory-style protocol. So you need to let them see that they are your only focus at their appointment. Every person wants to feel what? Special. Important. And what do you want? What do they want? They want to be acknowledged for efforts, not told that they are inadequate, lazy, or non-compliant, of course. If you treat the infection in their mouth, you will find improvement, and it will have very little to do with whether they floss or whether they take their toothbrush to work. Yes, it's important to have oral hygiene, but I have had people who were oral hygiene nuts and still did not get rid of their infection just with oral hygiene. And my hygienist and my dentist is much more powerful than the office I go to. Unless your internal communication is superb, patient preferences, protocol notes, promises of success, all these things, these are often missed. leaving the patient feeling less than ecstatic about the personalized service that they're getting. Because if you are systematized to the point where everybody is on this same protocol at the same time with the same criteria, then your system and routines become important for productivity and efficiency. But if the patient isn't at the core of your focus, isn't the center of that focus, you will find that they will not buy into your plan, even if it is for their welfare. Ever have a patient graduation after successful gum treatment? Many of you, after restorative, say you have graduated, you have done very well, and you are completed. How many of you consider it after gum treatment? And how often would you say that a person who is cured of infection, who has no pockets, who has no inflammation or bleeding, how often should they come in? In my office, graduation meant that if they were on every 2 to 3 months while they were being treated, they could graduate to every 4 or 5 months, eventually to 6 months. I had patients who graduated to every 2 years for their hygiene appointments because they did not need them any more often. The bragging of a patient who says, I don't need to come in every 3 months, I have graduated, is an excellent marketing tool for your office. If they say, I don't have gum disease, it's cured, that's another excellent marketing tool for you. Patients who say, I had bad breath, I no longer worry about it. Can you imagine how big that is? So graduating from perio program in my office meant that they went to a regular recall or even less. And you'd say, oh, but my hygiene department needs to make some money. Yes, they have more time to talk to patients, to help them value and accept more of the wonderful dentistry your office offers. And how about the cosmetic part of your offerings? They now can do that because their gums don't bleed. Does your hygiene department have time to do that now? If they're scaling, they rarely have time to talk to their patients. So, when they are finished, once they have been cured, they can be ready for other choices in your restorative and cosmetic department. And they are ready for those more quickly than if you had sent them away for their perio, or if they were still having bleeding in pockets, because you're not going to restore somebody with good cosmetic stuff unless their gums are really good. So now you don't have to wait as long because you're going to cure them and get them to that point much sooner. Once they know what to look for in their mouth, as far as infection is concerned, whether it's halitosis or bleeding or swelling or itchy gums or pressure between their teeth, or that they have an increased plaque accumulation, they will be back without a recall. They'll say, Doc, can I have this slide? I think I got myself an infection. It is not uncommon for people to come in and say, I think I need a slide. And that way you don't have to recall them every 3 months because they know. You have empowered the patient to diagnose their own problem and to seek out treatment. So, does that sound like something you would rather do than call them and remind them and hope they don't cancel their hygiene appointments? What if they do get reinfected? Now you have something that shows them what the infection is. If their husband brought it home, the husband comes in and gets it checked, and eventually the husband comes to your office as a patient because that makes more sense to him than what his dentist is doing. So it is a very good marketing tool. Also, if your perio program has a beginning, a middle, and an end, where you begin with a diagnosis, an enrollment, and a treatment plan, an estimate of time and cost, and then the homework, you will find that patients understand that better. They can get their heads around that much better. It makes sense to them. Open-ended treatments are rarely accepted and maintained on a long-term basis. Chiropractors, some of them will. But dentists, I know that in many of the offices I consult in, the biggest problem is hygiene appointments being canceled. So a written treatment plan, including your perio, a definite estimate for the perio treatment. And we've discussed those in other lectures that I've given, so you can check those on the videos that IAOMT has. And also an insurance predetermination for the whole amount and for the time required will help the patient plan and accept. And then end on a positive note at the end of treatment with a clear slide, with no bleeding, with no pockets, and with the next phase of treatment. So internal marketing. Make sure that patients understand when you finish their treatment that there is an opening in your schedule. That is very important. Announce the acquisition of your microscope to all your contacts, whether it's through Facebook or through your newsletter or just through email. Get adult family members in for a slide. Have handouts of articles on perio infections, the whole body connection, on how to avoid reinfection. Feature before and after pictures of successful perio cases. And some of you have a digital photo frame. Put those on there. Send a graduation card to the place of their employment for each phase of their treatment. That is a very powerful tool. I have found that this created a lot of referrals. Be bold in blowing your horn about advances in your knowledge, your skill, your team development, and ask for referrals. Ask for testimonials routinely. Testimonials are not just for you. They are also for your patient, because they allow the patient to see the value that they are receiving from you and to internalize that. So ask for testimonials. Put them on your website. Have a brochure for perio in the office describing how you treat gum disease. Make sure every staff member in the office is on the program, and do not be afraid to address halitosis. Bad breath is a $6 billion industry. Yet everyone is afraid to tell a sufferer that they stink. Many live every single day with the fear that they are offending. And we need to give them a helping hand. But I'll tell you, no amount of internal marketing will overcome the disastrous effect of one member of your team offending with bad breath, especially the dentist. And when a dentist has bad breath, he loses patience and does not know why. And his staff sometimes will not tell him why, because they're afraid of losing a job. So this is one way of getting the entire staff cleaned up. External marketing. Speak to seniors groups, caregivers, expected mothers, physicians, chiropractors, nutritionists, MDs on their rounds at the hospital. Take your microscope to health shows. Take slides for free. Write articles to your local health food store newsletter or corporate bulletins. Get interviewed on your local public TV. Who else would benefit from this information? Who in your office is the right person to do these seminars? It might not be the dentist. You might have a crackerjack of an assistant who really goes for this, and she might be the best one to market your office externally. Let her. Cable stations are always looking for newsworthy content of interest for today's baby boomer generation. They are into health. And microscopy is a very, very safe thing to put on the media. And of course, reward your patients. The patient uniqueness is honored by tailoring of the treatment. I don't care how much you know until I know how much you care is a common saying among us, but do we really care? And we need to show that. If your office is systematized to run like a factory, is the patient really being taken care of uniquely for themselves, not for your benefit? The rewards for the office of this kind of attitude is loved ones and friends get referred. You have a finite time when for treatment, and you know that it's going to be successful enough that you can start other treatment. Planning is much easier. Of course, congruency with the fact that we are a healthcare profession and not tooth carpenters. And of course, the cosmetic and restorative treatments are not hampered or delayed by bleeding or other issues. You are no longer seen as a tooth carpenter, a drill, fill, and bill dentist. So, with little tips, empower your staff. Let them run the perio department for you. Reward success. Consider a percentage or a bonus system for it. Train every single member of your team and hire and retain motivated people. I had the best success with people that never had any dental background. But they were motivated and they were excited about what I had to teach them, and they passed that on to my patients. So skills can be taught, but attitude and personality cannot be. Do you have regular meetings? Keep communications flowing, because the whole team needs to know and partake in the graduations of their people. So, are there any questions?
I have a question.
Yes.
You talked about, this is a standard of care issue. You talked about, I think you said about not understanding the reason. You talked about not probing and not cleaning until after the infection is gone.
That's correct.
So how do you get away with it while not doing a complete exam with probe before you do that treatment?
You will do it as soon as the infection is gone. So if your tonsils were infected, would you take them out? You would wait until the infection is gone. So that's the same principle here. I wait until the infection is gone, and then I probe. I did probe, and from an x-ray you can see bone loss and that kind of thing. And most of the time when you're probing and there's swelling, you really don't have an accurate picture anyway.
Right. And I understand that we also talk about predetermining insurance and things like that, which typically always requires probing. So I'm just trying to understand that.
Yeah. If you need to have more information, you can always do irrigation after you've done the slide, like Dr. Kennedy did, and then probe with a probe that you dip into some disinfectant.
Can we entertain the questions at the speakers forum at 4:30?
Sure. Thank you.
Let's give Dr.